Okay. Doctor, what kind of general impact can brain imaging have on an injury case?
Well, it really depends on the injury. For example, in traumatic brain injury, even mild traumatic brain injury, what is often called a concussion, there will be signs of changes in the function of the brain. And some of those signs show up clinically, such as decreased ability to concentrate or perform your job that requires cognitive function. But there are also signs that don't show up as readily clinically. And that's where a functional brain scan, such as a SPECT scan, really comes in handy. It helps you see, okay, this is exactly the area of the brain that's not working well. And the advantage of that is now we actually have some treatments that can actually help that, so improve the function of the brain. So a variety of different techniques are now being used to help improve the function of damaged or injured brain.
So you have an individual, and they just know something's not right, and then they don't have the expertise to know other than something is wrong with me, or I'm not really where I should be, and you're able to have them go through this process and have a scan, and then more importantly interpret it for them. What type of impact does that have on them typically?
Well, there are patients who come to get a scan because, for exactly that reason, something's not quite right. They don't know what it is. And they don't necessarily associate the fact that, well, they had a very significant bicycle accident as a child, or they played football in high school, or they had several serious falls skiing, which resulted in mild traumatic brain injury. In fact, at a recent debate about the advantages and disadvantages of SPECT brain imaging, it was said that if we just scan patients looking for traumatic brain injury, there'd be thousands of scans done in America alone. Because traumatic brain injury presents, for the person who doesn't necessarily know, oh yeah, that was a brain injury, as things like depression and anxiety and problems with attention, and they're wondering, gosh, am I depressed? Gosh, do I have ADHD? So it really has a great impact upon their life, finding out that, no, this isn't in your imagination, this is something real.
When the situation involves an accident, and now here come the lawyers and trying to sort things out, we are seeing SPECT imaging becoming admissible in court. Why do you think we're seeing that?
Okay. Brain injury is...
I'm sorry, can